Good morning to you. It's Tamika Chambers. Today's date is September 24th, 2024. And I have another question for you. And as always, remember, I recommend that you get something to write with, something to write on. And as you're doing questions with whoever you're doing questions with, pause the video, write down your answer as well as what your rationale is. And two parts. One of them is that you want to boost your critical thinking skills. And number two, you want to see if you want to improve thinking like a nurse. So let's go ahead and do this question here. You are assigned to provide nursing care for a patient receiving mechanical ventilation. Which action should you delegate to an experienced nursing assistant? All right, so we're going to read the statement as it is, paraphrase. Which action do you provide? Which action should you delegate or give to an experienced nursing assistant for a client on mechanical ventilation? All right. Keywords, we have mechanical ventilation patient, delegate action, experienced nursing assistant. That's what we're going to key in and focus on. All right. So do we delegate assessing the patient's respiratory status every 4 hours, or taking vital signs and pulse oximetry readings every 4 hours, or checking the ventilator settings to make sure they are as prescribed, or observing whether the patient's tube needs suctioning every 2 hours? So you have to know something about delegation, right? That's where you're keying in. And I am going to give this to an experienced nursing assistant. Should you be concerned about experience? That's the question. Go ahead and write down your answer and then come back. Also write down your rationale or state it and then come back to this video. All right, so here we go. So what I do recommend with nursing assistant, as you go through the statement, I do recommend that you remember delegation, AEPT. You don't want to delegate assessment, evaluation, planning, or teaching. So if we're given this assessing the patient respiratory status, this needs to be someone who is well advanced in education to do this. Taking vital signs and pulse oximetry readings every 4 hours, we're going to keep that. Checking the ventilator settings to make sure they are as prescribed. Again, someone needs to be well trained to do that, right? Either RT or the ICU nurse, or the specialized nurse. And then observing whether the patient's tube needs suctioning. That's more of assessment, right? So C, D, more of assessment. We're assessing still. B, we know that nursing assistants can take vital signs every 4 hours. If you missed it, no worries. Check and see why. If you got it right, congratulations to you. And just a side note, you guys, I do provide individual tutoring for Nclex candidates to help them pass their exam. You can reach me at tamikaj@aim.com. I also encourage T-charts or compare and contrast charts for sticky things like delegation, medications, etc. You can also find that on Fulfill